Well, thank you again to Congresswoman Adams for joining me for that conversation. Let's give her and her incredible leadership on this issue a round of applause. Now, we are going from one incredible leader to another, and I am so honored to be able to introduce our next speaker, Secretary Xavier Becerra. Secretary Becerra is the 25th Secretary of the Department of Health and Human Services and the first Latino person to hold the office in the history of the United States. Throughout his time leading HHS, Secretary Becerra has worked tirelessly to end the COVID-19 pandemic, to reduce healthcare costs, expand access to care, tackle health disparities, and strengthen behavioral health. His work builds on a lifetime of public service, from his early days as a legal advocate representing people with mental illness to his role of Attorney General of the state of California defending the ACA and reproductive freedom, to his 12 terms here in the United States House of Representatives. In each of these roles, Secretary Becerra has been a fierce champion of health equity, and that mission at HHS has included a specific focus on addressing our nation's maternal health crisis. I've been so honored to partner with Secretary Becerra on maternal health since the very beginning of his tenure. In November of 2021, Secretary Becerra joined me at a community health center in Illinois for a conversation on maternal health. And just this spring, we came together for a roundtable discussion at HHS for Black Maternal Health Week. Through the last 2.5 years, Secretary Becerra has led department-wide efforts to address the root causes of our nation's maternal health crisis. I am so delighted that he's here with us today to describe these initiatives and the ongoing work that HHS is doing to save moms' lives. Mr. Secretary, thank you so much for being with us here today and for all the work that you are leading. It is now my pleasure to introduce the Secretary of Health and Human Services, Xavier Becerra.
Good morning. Ooh, one more time. Good morning. Yes, yes. Do you have any coffee, Congresswoman Underwood, that we can make sure we pass along? I want to say thank you to all of you for being here at this summit. I want to thank first and foremost Congresswoman Underwood. She's being very gracious. She talked about this partnership. Really what it was she said, you got to come to this event that I'm doing and you got to really push on these things. So, you follow orders and you do what the Congresswoman says. She knows what she talks about, and she's also a former employee at HHS. She's a nurse and she did work at HHS, so she knows what she speaks of. She knows where all the little jewels are hidden at HHS. She knows the levers to push. So I'm here because Congresswoman Underwood says, come to this summit. So it's important to be here. I'm thrilled to tell you some of the things that we're doing, but more importantly, I'm thrilled to enlist you the way Congresswoman Underwood enlists me to make this happen, because we know that in such a great country with so many resources, how we can have women who are dying, Olympians who are 32 years old dying during delivery while they're pregnant. It doesn't make any sense. Of course, neither do the social determinants of health, which drive so much of what happens in America, make sense either in such a rich, prosperous country. So let me spend a few minutes with you to talk about what HHS is doing. But then I want to stop because I want to talk about what we should be doing. Today in America, because President Biden has made this an emphatic push of his, Medicaid, which covers nearly half of all deliveries in America today, is offering not just 60 days of care after a woman delivers, because that's what Medicaid would do, 60 days of postpartum care. Many of you may have experienced this. Many of you may know clients who experienced this. Today, that woman is entitled to 365 days of postpartum care because of the push of people like Congresswoman Underwood, because of the decision and determination of President Biden to make sure we address the ills that we see today with too many Americans who are suffering during pregnancy and in some cases dying, and in some cases dying 2 to 3 times the rate of white women who are pregnant as well. That's the circumstance of black women in America. That's the circumstance of indigenous women in America. And so today, we are able to, if a state accepts it, offer a woman in America 365 days of care after she delivers her baby. That's the good news. The bad news is there's still some 10 to 15 states who haven't yet signed up to offer the women in their state 365 days of care. So on day 61, she and that baby are on their own. We need to work on that together to make sure there's no state in America who is depriving a woman in this country and her baby the care that they could really use. We have a hotline, a maternal health hotline for those who are going through stressful times, mental health support. And I hope that you are aware of that, and I hope you will tell others around the country that there is a hotline that's available to them, 833-TLC-MAMA. And for those who don't want to worry about the letters, 833-852-6262. That line is there for women who need to reach out. We set that up. Within the last year, we've already gotten thousands of calls. The president asked us to set up a blueprint for how we're going to deal with maternal health moving forward. That's one of the reasons we have 365 days of care within Medicaid. But we also are now putting money into workforce development in our minority communities. And so we have recently placed out grant money of over $15 million so that we can build the workforce, especially of those underserved communities, so we can make sure that when you go get your care, you're getting it from someone who knows your experience. We need your help to make sure people are aware of those grants so they can apply, and we need to get the young people in to become the healthcare professionals of the future. We're making sure that in every respect, we are trying to address the healthcare needs of those who are going to give us the next generation of leaders in America. And so here's where I stop to tell you what I know we must do. And I can say to you, I know we must do this because for most of my career, I have had the wisdom, experience, and expertise of someone who understands maternal health, a high-risk OBGYN who has, in every step along this path, been able to guide many of the things that I've been able to do. Fortunately for me, she continues to stay married to me, Dr. Carolina Reyes. She is a maternal fetal medicine specialist and has been on this. Back in the 1990s, she helped author the report of Unequal Health that talked about these types of disparities. She's been working on this for the longest time. Now it doesn't hurt that she's got somebody who she can whisper to and say, hey, you're at HHS. How about you try to do something about some of these things? And so we're taking on a number of these issues. But here's where I think the partnership really has to develop with you, with Congress, with the states, everyone who has a chance to make a difference. Why is it that we treat healthcare like something that we attack only when you're ill? Our system is based on illness care. So you have to get sick before you really have us paying attention to you. And if you're not insured, we don't pay attention to you until you have to make it to the emergency room. Why can't we have a system of health that's based on wellness so that before you get really sick, we're trying to treat you up front? Because we know that for the most part, the folks who don't get access to care are the folks who have the least resources or who have been ignored the most. And so if we go towards a system of wellness care instead of illness care, we have an opportunity to start from scratch. As my mom would say to me, mejor prevenir que remediar. Better to prevent than to remediate. Or as Frederick Douglass said, better to build strong children than to repair broken men. Let's start early. That's what we want to do. How do we want to start early? We consider food as medicine at HHS. What does that mean? There should be no food deserts anywhere in America. That if you take your child in for a wellness care checkup, and your physician says, looks like your daughter's doing fairly well. She's a little deficient in this, or she needs to do a little bit on that. Here's a prescription. See you in about a year. Take that prescription. You pass by the pharmacy. You go into the grocery store. You pick up the fruits and the vegetables and the berries and the nuts. You go to the cashier. Cashier totals it up. It says, oh, okay, your bill will be X. And you say, wait a minute, I got a prescription. Oh, I see you've got your prescription for your daughter. 20% discount for all those fruits and vegetables, nuts and berries. Because that is medicine. And the quicker we begin to realize that we have to make the best medicine, the most natural medicine available to our families, the sooner we're going to move towards wellness versus just illness care. And so we can make that happen. We want to make that happen at HHS. And we're beginning to support states that are using their Medicaid dollars to actually pay for those who want to avoid food insecurity by making nutritional programs available using Medicaid dollars. We also want to make sure that we use our lever to make sure that we support those programs in communities that work. And that's why we are now funding doula programs throughout the country, because there is no reason why you should go through the pregnancy, the 9-month period, by yourself. And if we are funding programs that let you have a community worker at your side, helping you get through the process so you're ready to deliver, we believe the outcome will be far better. And so I say to each and every one of you, there are ways that we can work together to make this happen. We can convert our system of illness care into one of wellness care. We can make sure that people recognize the early investments, food as medicine, doula care programs, building the pipeline of professionals that look and sound like us, making sure that we offer the care that someone will need, not just for 60 days, but for 365 days, will make a difference. This is where you come in. Congresswoman Underwood could use some help getting a few more votes so that I can continue to fund a program that gives us the opportunity to say to a woman, you're going to have care for 365 days for yourself and for your baby. Help us get there. We can make it happen, but it does take the village. I hope you are a village that's ready to rise up. I hope we can work this together, because at the end of the day, it is far easier to build strong children than to repair broken men and women. And so I look forward to working with you. I thank Congresswoman Underwood for inviting me. I hope you will see that at HHS, we're looking forward to partnering with you. Thank you very much.
Thank you, Secretary Becerra, for your powerful remarks. We appreciate all the work that you're doing, leading the Department of Health and Human Services, and I am so, so grateful that you could join us here today for the summit.